Hello, my name is Harriet Raimundo. I am a family nurse practitioner student at Fairleigh Dickinson University, and I am going to be doing a full head to toe assessment. I already have gathered all my equipments with me. I already washed my hands, and I will be providing privacy to my patient all throughout the assessment. Hello, sir. My name is Harriet. I am a family nurse practitioner student, and I will be doing your head to toe assessment. Is that okay?
Yes.
All right, so to start our mental status exam, can you tell me your full name?
Rudy Raimundo,
What's the date today?
May 14th, 2021.
Tell me where you are.
Dumont, New Jersey.
And who is the president?
Joe Biden.
Okay, patient is alert oriented times 4. I'm going to tell you 3 words. I want you to remember them. And at the end of the assessment, I'm going to ask you what those 3 words are. Okay, so it's Florida, boat, and fishing.
Florida, boat, fishing.
Okay. So has anything been bothering you lately?
No.
Can you count 1 to 10 backwards?
10, 9, 8, 7, 6, 5, 4, 3, 2, 1.
All right. Patient speech is clear, able to maintain eye contact, appropriate response to subjective data, and able to cognitive ability is intact. All right. Now I'm going to check your skin. Did you notice any rash, lesions, or any discoloration anywhere?
No.
Okay. So skin is warm, no swelling noted, no rash noted, and turgor is intact. Now I want to check your vital signs. 97.4 temperature. Check your blood pressure. And what's your height and your weight?
5'11", 190.
5'11" and 190. Okay, good. Okay, blood pressure is 120/70. That is good. Vitals are okay. Now let's check your head and your face. So let me check your hair. Hair is black and evenly distributed, no patches noted. Now I'm going to palpate for any bumps or lumps, and nothing noted. And then I'm going to palpate your temporal artery. Okay, temporal artery is strong and equal on both sides. Okay, so now I'm going to check your cranial nerve number 5, which is your trigeminal nerve. Can you clench your teeth while I palpate your temporal muscle? Okay, it's hard and strong on both sides. And then I want you to tell me if you feel a sharp sensation or a dull sensation. Okay, close your eyes.
Dull. Dull. Sharp. Sharp. Dull. Sharp.
Okay, so sharp and dull pain is intact all over the face. Okay, now we're gonna check cranial nerve number 7, your facial nerve. So can you raise your eyebrows, bring it down, frown, smile, clench your teeth, and puff out both cheeks. Okay, very good. Okay, next we're gonna check your eyes. So far I see that the eyes is equal, it is symmetrical, no swelling noted. It is clear, free of drainage. Conjunctiva is pink and sclera is white. Okay, I'm gonna check cranial nerve number 2. So you see, using a Snellen chart, can you read line number 8 with one eye covered?
DEFPOTEC.
Okay, the other eye?
DEFPOTEC.
And both eyes. uncovered?
DFPOTEC.
Okay, very good. So now look at me and tell me when you can see my fingers. Okay?
I can see. I can see. I can see.
Okay, very good. Now we are going to check cranial nerve number 3, 4, and 7 and 6. Cover one eye for me, and then I want you to follow the pen light, okay? Without moving your head. Okay? Do it on the other eye. Okay, very good. Now I'm going to shine a light and check your pupils. Okay, they're reactive. And then I want you to just focus on the tip of the pen light and follow it. All right, so patients, eyes is 3 and brisk. They are equal, round, and reactive to light and accommodation. Okay, so next we are gonna check cranial nerve number 8, which is your hearing. Cover one eye for me, and I'm gonna whisper, one ear for me. I'm gonna whisper and you repeat the 2 words that I tell you, okay?
Apple, banana.
Okay, do it on the other ear.
Mango, tomato.
Okay, so now I want to check the conduction. We're gonna do the Renee's test and the Weber test, okay? For the Renee test, you're gonna tell me when you stop feeling the sensation right here on your mastoid process, okay? And then you also say stop or no more when you don't hear the tune anymore, okay?
No more. No more.
Okay, great. Good.
No more. No more.
Okay, and now we're gonna do the Weber test. So you tell me when you feel the sensation. When do you feel it more? Is it on the midline, or is it on your right ear, or on the left ear? Okay.
Middle.
Okay, very good. So cranial nerve number 8 is intact. Now we're gonna check your cranial nerve number 1, your olfactory. Okay, I don't see any drainage, no blockage noted. And then I want you to close your eyes, and I'm gonna let you smell something and tell me what it is.
Vanilla.
Okay, very good. Now you can open your eyes. Okay, now I'm gonna move to your mouth and lips. So I see the lips is pink. It is dry and intact. Open your mouth. The tongue is also pink, no lesions. The teeth, no missing teeth noted, and the mucosa is also intact and pink and no lesions. I'm gonna go and check cranial nerve number 9, 10, and 11. So open your mouth. Say ah. Okay, very good. The uvula is midline and it moves up with phonation. Stick out your tongue. Move side to side, and try to puff out. Try to push out your cheek. Very good. Okay, and cranial nerve, your hypoglossal nerve is strong. Tongue is midline, and it's strong on both sides. No weakness. Okay, so now we're gonna move on to your neck. I don't see any swelling. They are symmetrical. Trachea is in the midline. Okay, swallow for me. Okay, and the thyroid moves up when swallowing. Now we're gonna check your lymph nodes. Preauricular, postauricular, occipital, tonsillar, submandibular, submental, superficial cervical, posterior cervical. Okay, turn your head. Deep cervical, other head, deep cervical, supraclavicular. Okay, and then I want you to move your head up and down, side to side, and look left and right. Okay, very good. So now I am gonna listen to your carotid artery. I want you to inhale, hold your breath. Okay. I'll inhale and hold your breath. All right, carotid artery is equal on both sides, no bruising noted. Okay. Now I want to listen to your lungs on the posterior and the anterior part. Okay, that's clear. Breathe in and out. Okay, patient's breathing is regular. It's unlabored, chest excursion is symmetrical, and breath sounds are clear, posterior and anterior. Okay, now I'm going to listen to your heart sounds. I'm listening to your aortic valve, your pulmonic, tricuspid, and mitral. Okay, heart sounds, S1, S2 is normal, no murmurs noted. Okay, now we're going to check your peripheral vascular system on your upper extremity. I'm going to check your pulses. Brachial pulses equal. Radial pulses equal. And capillary reflexes are less than 2 seconds. Okay, now I'm going to check your abdomen. So I want you to lay down for me. Okay, just inspecting the abdomen. Abdomen is no swelling noted. It is non-distended. Skin is evenly distributed. Umbilicus is clean, no rash noted. Now I'm going to auscultate for the bowel sounds. All right, bowel sounds are present and active on all 4. I'm going to do light palpation. Any pain or tenderness?
No.
Okay, no pain and tenderness. And then I'm going to do deep palpation for any palpable mass. Any pain?
No.
When I press down, okay, so no palpable mass noted. So while you are on a lying position, I'm going to check your musculoskeletal, your peripheral vascular system and your musculoskeletal system with your range of motion. Okay, so skin is even, no swelling noted, and pedal edema is equal and strong. Okay, so we'll do the range of motion on the lower extremities, okay? So try to move the leg up and down to the side, and across. Okay, now do it on the other, down, side, across. Okay, now knee to your chest. Okay, and then I'm gonna in, out. Any pain?
No.
Okay, now your leg, now your feet, up, down, side to side, and wiggle your toes. Okay, very good. And then do the knee to chest. Okay, in, out, up and down, round, make circle, and wiggle your toes. Okay, so range of motion on the lower extremity is full. It is 5. It's equal on both sides. And then I want to check the muscle tone, the muscle strength. Try to go against resistance. Very good. And try to push my finger. Okay, great. It is strong. You can sit back up now. Okay, now we're going to go back to the musculoskeletal system of the upper extremity. But I want to start with cranial nerve number 11. So can you shrug your shoulder? Okay, and try to push your head against my hand. Okay, very good. Okay, now we're going to check range of motion on the upper. So you can stand up. And then I want you to just move your hand up, down, and then front, and all the way to your back. Okay, very good. No limitation. Do with your elbow, same. Then outward, and then your fingers close, open, open. All right, now I'm going to check for strength. Flex both. Okay, try to pull toward you. Okay, and push. Very good. It is strong. Okay, now while you're sitting up, we were going to test your gait to check your cerebral function. So I want you to walk. Okay, and back. Okay, gait is steady. Okay, close your eyes. Okay, Romberg test is negative, and then you can sit back down. Can you put your palms in your thigh, open and down, and then do it as fast as you can. Very good. Okay, so now with one finger, touch my finger, touch your nose. Okay. Okay, do it on the other finger. Nose. Nose. Okay, very good. Next, we're gonna do your sensory function. So I wanna put a object in your palm, and I want you to identify it. Okay, open. What is this?
Earphone.
Okay, and then this one.
Thermometer.
Okay, next I am gonna, you tell me the letter the letter that I write on your palm. Okay, close your eyes.
C. I.
Okay, next one.
O. You doing it? H.
Okay. Now we are gonna do, keep your eyes closed and you tell me what body part I tapped, okay?
Cheek. Right cheek. Left cheek. Right wrist. Right hand. Left hand. Left shin. Right shin.
Okay, very good. Now we're gonna do your deep tendon reflexes, okay? So we're gonna do your biceps first. Relax. Relax your arm. Okay, very good. And then relax. We're gonna do your triceps. Okay, very good. Now your brachioradialis. Okay, and then your patellar reflex. Okay, and then your Achilles. Okay, great. Gonna do the same one on this. Relax. Okay. Very good. Okay, very good. And then this one. And your Achilles. Okay, great. So all reflexes are intact and normal. So now, do you remember, now can you tell me the 3 words that I asked you to remember?
Florida boat fishing.
Okay, great. And that concludes our head to toe assessment. Thank you.